Hi, I'm Dr. Steve Volan. I'm an OBGYN at the Women's Health Group here in Thornton, Colorado. I'm here to talk to you today about overactive bladder, or what is also referred to as urge incontinence. The medical definition of overactive bladder is a sudden involuntary contraction of the detrusor or the muscular wall of the bladder causing urinary urgency. I like to refer to it as you know you gotta go, and when your bladder is telling you you gotta go, then you'd better get to the bathroom. With overactive bladder, you will feel like you need to urinate and you'll have urgent bladder contractions. You may only have a very little bit that comes out. A normal amount of urinating is less than 8 times during the day and waking up less than 2 times at night. So if you're going more than that, you may have overactive bladder. Causes of overactive bladder are often difficult to tell, and the most common reason is idiopathic, where we don't actually know what's causing it. However, urinary tract infections are a very frequent cause, and part of our workup will always be to test you for urinary tract infections. For many women, hormonal changes, where there's some vulvar or vaginal atrophy due to a decrease in estrogen, can lead to these symptoms. Finally, we always want to track the amount of water you drink, because the amount of water could cause you to need to go urgently as well. And finally, certain medications also cause overactive bladder symptoms. Treatment starts behaviorally. For example, if you tend to swell up during the day and then urinate a lot at night, often we'll give you a water pill and have you decrease the amount of water you drink at the end of the day. Dietary adjustments are also sometimes necessary because there's certain foods in particular that may affect your bladder. Typically, we'll do a diet elimination with the common irritating foods, and if we notice improvement, we'll work from there to figure out what's causing it. Finally, we often will use medications to help treat overactive bladder, and there's a new medication out called Myrbetriq, along with some of the newer anticholinergic medications that have many less side effects than the unpleasant sedation, dry mouth, and constipation that older medications often have. Medical treatments and behavioral treatments will treat well more than 90% of patients with overactive bladder. But lastly, you may need a procedure to treat it if you don't respond to less invasive means. BOTOX is directed directly into the bladder wall. It's minimally invasive, and while it paralyzes part of the bladder wall, it lets you hold more urine and urinate less frequently. Finally, there is PTNS and INTERSTIM. These two procedures both work by resetting the nerves from the bladder to the spinal cord. They're minimally invasive procedures. They tend to work very well when all other treatments have been exhausted with no good results. I hope you learned some new information about what overactive bladder is, what causes it, and the treatments with it. Here at the Women's Health Group, we're happy to see you if you're unable to solve these issues by yourself or with your primary care doctor. Again, thank you for your time.